Good afternoon, everyone. Thank you for joining us today for the Hospice Quality Reporting Program Review and Correct Report webinar. My name is Sharon Purcell, and I will be your host and moderator today. I have a few housekeeping items to share with you. This webinar is being recorded. It will later be posted to the CMS Hospice Quality Reporting Program Training and Education Library webpage. If you would like to download today's presentation slide deck, click the Browse To button found in the Web Links panel in the lower portion of the screen to access the shared files. The presentation slide deck is also posted to the Hospice Quality Reporting Training and Education Library webpage in the Download section. If you download the presentation while in the webinar in Adobe Connect, you will need to return to the presentation by clicking the Adobe icon located in the taskbar. We will provide you with details on accessing the recording via email when it is available. Due to a large number of attendees on today's webinar, we are unable to field questions over the phone, but you can submit questions electronically. The phone lines will be on mute for the duration of the presentation. The audience is in the listen mode and will only be able to communicate with us by using the Q&A panel. If you need technical assistance during this webinar, please let us know by entering your question or concern in the Q&A panel to the right of the presentation. You may also ask any content-related questions you may have during this presentation via the Q&A panel. We will answer as many questions as possible during the presentation. Questions submitted during this webinar will be distributed to the appropriate help desk. They will be posted to the Hospice QRP Requirements and Best Practices webpage as soon as responses have been drafted. More Adobe Connect help can be found by clicking on the help icon in the upper right-hand corner of the screen. Closed captioning is available during this webinar. You will find the captions located in the panel directly beneath today's hospice presentation. If you need any technical assistance with closed captions, please let us know by entering your question or concern in the Q&A panel to the right of the presentation. A disclaimer has been provided for your review. Please keep in mind Medicare policy changes frequently, and please refer to the links provided in the presentation for the source documents. We encourage you to review the specific statutes, regulations, and other interpretive materials for a full and accurate statement on their contents. During today's HQRP Review and Correct Report webinar, we will cover the following: hospice quality reporting and overview, hospice quality measures, certification survey provided enhanced reports, known as CASPER, review and correct reports, case studies, and then we will have a wrap-up with questions. Now, I'd like to introduce today's speakers. Presenting the HQRP Review and Correct Report webinar are Charles Padgett and Brenda Karkos. Charles Padgett is a registered nurse who has been in practice for 15 years. For the past eight years, Charles has been a nurse consultant at CMS in the Division of Chronic and Post-Acute Care and has worked extensively within the post-acute settings, including hospice, on policy and quality reporting. Most recently, Charles has led the post-acute care public reporting efforts, including the development and maintenance of the COMPARE sites, including Hospice Compare. Previous to his work at CMS, Charles worked with the clinical research and emergency medical fields. Brenda Karkos is an associate nurse researcher at App Associates. She is an RN with many years of experience in hospice, oncology, and community health, including as the Director of Hospice. She currently serves on the Board of Directors for the State of Hospice Associations in Mass and is a member of the Hospice and Palliative Care Nurses Association. Her work at APP is focused on health policy, qualitative field work, and training projects for hospice, oncology, and home health care. Included in today's slide deck is a reference of acronyms that will be used throughout today's presentation. More acronyms. The objectives for today's webinar are discuss the purpose and framework of the Hospice Quality Reporting Program, describe public reporting and the content of the HQRP, locate the Hospice Compare website to view measure results, identify the hospice quality measures and types of data source, describe how to access the review and correct reports and certification and survey provider enhanced reports, CASPER. Discuss how to interpret review and correct report results. Utilize the review and correct report to perform quality improvement analysis using a case study. Locate resources on the HQRP website. During today's presentation, we will occasionally engage the audience in polls. The presenter will read the question and the possible answers. The poll will appear in a panel to the lower right. If you want to see all answers to the polling questions in the polls panel, you may have to scroll down. To participate in the poll, you simply must select your desired response to the question. Now let's try a poll. Let's give it a try. In which year was the hospice Medicare benefit first implemented? A, 1972, B, 1983, C, 2001, D, 2008. I see several answers have come in. Now let's get the correct answer. The answer is B, 1983. We will conclude today's webinar with a question and answer session and finally a wrap-up. As a reminder before we begin, we encourage you to submit your questions in the Q&A panel to the right of the presentation. We are pleased to have such experienced and knowledgeable speakers presenting today's webinar. Brenda and Charles, thank you for being here today. It is now my pleasure to turn the session over to the presenters. Charles and Brenda, you may begin.
Hi there. Thank you, Sharon. So let's start with a review of Hospice Quality Reporting Program. So what is the HQRP and why is it important? The Affordable Care Act authorized the establishment of a quality reporting program for hospices and specifies that hospice programs shall submit data on quality measures. The Hospice Quality Program, or HQRP, promotes the delivery of person-centered, high-quality, and safe care by hospices. The Centers for Medicare and Medicaid Services has sought to adopt measures recommended by multi-stakeholder organizations and developed with the input of providers, purchasers, payers, and other stakeholders. So let's just, as a refresher, look at what's required. So currently there are two requirements for the HQRP. The first one is the hospice item set. You may hear this referred to as the HIS or also as the HIS. And the second requirement is the Hospice Consumer Assessment of Healthcare Providers and Systems, or the CAPS Hospice Survey. All Medicare certified hospice providers must comply with these two reporting requirements. We'll briefly touch on each of these in the next few slides. The HIS gathers patient and agency-level information on each hospice admission and discharge, while the Hospice CAPS gathers important input in regard to the patient and family experience in hospice. CMS implemented the hospice item set as part of the HQRP in the fiscal year 2014, and hospices began collecting data using the HIS on July 1st of 2014. The national implementation of the CAPS Hospice Survey began in January in 2015. So here's a graphic that displays what best makes up the Hospice Quality Reporting Program, or the HQRP. So the requirement is both the HIS and the CAPS, and hospices must comply with both of these components in order to meet the requirements. So let's just talk about the HIS data submission. The data collection year runs from January to December. The HIS data needs to be submitted and accepted in a timely manner and must meet the threshold requirements. When the HIS was first collected, the threshold was lower at 70, then 80%. At this point, 90% of the HIS records need to be submitted and accepted timely in order to comply. So you can see from this graphic that records from 2018 will impact the fiscal year 2020, and so on. So records from this year, 2019, need to be at a 90% threshold and will impact the fiscal year 2021. So these are the current HIS quality measures and their corresponding National Quality Forum numbers. These are the quality measures that are currently being collected. It's treatment preferences, beliefs and values, pain screening, pain assessment, dyspnea screening, dyspnea treatment, bowel regimen, hospice comprehensive assessment, which basically comprises numbers 1 through 7, and then hospice visits when death is imminent. So this slide talks about the CAPS data submission, and this is the Hospice Consumer Assessment of Healthcare Providers and Systems, otherwise known as the CAPS Hospice Survey. This survey measures the experiences of patients and their caregivers, that what they have with hospice care. The national implementation of the CAPS Hospice Survey, as we mentioned, began in January of 2015. The goals of the survey are to produce comparable data on patients' and caregivers' perspectives of care, create incentives for hospices to improve the quality of care through the public reporting of survey results, and to hold hospice providers accountable by informing the public about their quality of care. As with the HIS, the data collection year runs from January to December 31st, and each hospice must contract with an approved survey vendor. This vendor must successfully submit data to the CAPS data warehouse on behalf of the hospice. Prior to 2015, hospices were not all using the same type of patient-family surveys. Therefore, it wasn't possible to compare the hospice quality based on these surveys. So on August 16th, CMS launched Hospice Compare, a website to help consumers compare hospice providers' performance and assist consumers in making care choices that are right for them. As of February of last year, there are 8 categories from the Hospice CAPS survey that are now publicly reported on the Compare website. And these include the communication with family, getting timely help, treating patient and family with respect, emotional and spiritual support, help for pain and symptoms, training family to care for patients, rating of the hospice, and the willing to recommend this hospice. Now, some of you might be familiar with the Compare website that are available on www.medicare.gov when searching for nursing homes or home health agencies. And this is what you'll see if you're looking for hospice on Hospice Compare. This is a screenshot of the main page, and you can search by a name or a zip code, and then the site allows you to choose up to 3 agencies and compare them. Potential patients and families can get an overview of the providers in their area and decide who to call based on their findings, and they can compare the quality data, the services offered, and also see the dates that a hospice agency was first certified. Like other CMS Compare websites, the Hospice Compare website will in time feature a quality rating system. So here is a graphic that just demonstrates the reports that are available for your use in CASPER. And these are confidential for providers before the information becomes publicly available. So you can see that we have the new review and correct reports, the quality measure reports, which you've already been using, and the provider preview report, which lets you see what's going to be coming out onto Hospice Compare. Okay, so now I'd like to briefly review the reports that are available in CASPER and how you access these. So CASPER has many valuable reports with specific functions to help you review the information you submit. You will start by selecting the CASPER reporting link on the CMS Quality Improvement and Evaluation System, or the KEYS, for providers webpage. Then you'll locate hospice-specific reports in these categories in CASPER: the Hospice Provider category or the Hospice Quality Reporting Program. The best resource for you in regard to CASPER reports is the CASPER's Reporting User's Guide for Hospice Providers, and it's available at this website that is on this slide. And you'll notice there's a footnote here that in the future, all of the current KEYS functions will change to a new platform called iKeys. So be looking out for more information on that in the next coming months. So here's a screenshot of the login page. You'll need to use your user ID and your password. And as a reminder, you can have 2 users on the system, so it's really important to identify another person in your agency who has access to CASPER to cover for vacations and ensure timely reporting. So there are 2 report categories: the Hospice Provider and the Hospice Quality Reporting Program. And you can see that the Hospice Provider report category is highlighted on this screenshot here. Under that category, you have a number of reports to choose from, and I'll just name a few of those that are listed here. There are 4 types of error reports. There are admission and discharge reports, and then there's the final validation report. And you'll also find the Timeliness Compliance Threshold report in this category. And this report summarizes the number and the percentage of HIS records submitted within that 30-day submission deadline for annual payment update, or APU, determination. So you can select any one of these user-generated reports, complete the fields for the time period you'd like to see, and then you can print them out for use by your hospice. So let's look at another category of reports in CASPER, and these are the provider preview reports. And the purpose of these reports is to give providers the opportunity to preview their HIS quality measure results and Hospice Consumer Assessment of Healthcare Providers and Systems, or the CAPS, survey results prior to public display on Hospice Compare. As of March 2018, the Hospice Provider Preview Report and the Hospice CAPS Survey Report were made available. There are 2 separate reports, and these are automatically stored in your provider's shared folder in CASPER. Hospice providers are encouraged to use these to review their hospice item set, quality measure results, and the facility-level CAPS survey results. Prior to each quarterly release of data on Hospice Compare, hospice providers are given an opportunity to review their results during a 30-day preview period using these provider preview reports. And these reports are provided after the freeze date. Because of this, hospices are not able to make changes to the underlying data. Providers need to take action to ensure all data is accurate prior to that freeze date. And if hospices fail to make necessary corrections to the HIS data before this freeze date, CMS will base the measure on the data that was in the CMS system at the time the quality measures were calculated. So again, it's important to use all of the reports that are in CASPER, so you can use some of those throughout the period of time well before you even get the provider preview report. Now let's look at the Hospice Quality Reporting Program category. Select the Reports tab. A list of the reports available in this category will display to the right, and these include the hospice patient stay, or patient, usually admission to discharge, that level report, and then the hospice review and correct report, and the hospice level QM report. And you can see the report highlighted to the right in red is the hospice level quality measure report. So this HQRP QM report category contains user-requested on-demand reports in CASPER, and these give you confidential feedback on your agency's performance. You can run these for any reporting period of your choice, and they can include a full year of data if you request. They include both the patient level and the hospice level data. And data are calculated monthly around the middle of the month. Any assessments submitted after the calculation date will be included in the next monthly calculation. And the data was calculated on date will show you when the most recent calculation occurred right on the report. Because these display the national average scores, you can also use these for benchmarking and comparisons. I'll briefly explain just two of these reports now, but Charles is going to go into much more detail in a few minutes in regard to the review and correct report. So for the hospice level QM report, you're going to see for the 8 measures, the report shows the CMS measure ID, and this is a unique ID that identifies that particular measure. And it also will show the numerator and the denominator, the hospice's observed percent, and the comparison group national average for that same time period, and the comparison group national percentile, which indicates your ranking, the hospice's ranking nationally. Now, the hospice patient stay level quality measure report is much more detailed. It's going to identify each patient whose qualifying HIS record was included in the quality measure calculations for the selected report period per patient measure, whether the patient stay triggered the measure, in other words, did they meet the numerator criteria, whether they did not trigger the measure, or whether the patient stay was excluded from the denominator. And it's also going to tell you if the outcome was not available due to the patient still being active, or the admission record might have been missing, or if the measure was not implemented based on the patient's admission and our discharge dates. So now let's go to a knowledge check on what we just reviewed. So which reports below are included in the HQRP folder in the CASPER system? Is it the Hospice Review and Correct report, the Hospice Stay Patient Level Quality Measure report, the Hospice Level Quality Measure report, or all of the above? And I'll give you a few minutes. Okay. So it looks like 98% of you chose the right answer. It's basically all of the above. So now I'm going to turn this over to Charles, who's going to go into much more detail about the new report, the Review and Correct report.
Thanks so much, Brenda. Good afternoon, everyone. Thanks for joining today. I appreciate everybody's attendance. I'm going to do a bit of a deeper dive into the Review and Correct reports for the hospice setting. These reports were new for hospices as of April 1st of 2019, just a couple months ago. They contain hospice-level quality measure data for a full 12 months or 4 quarters. They also contain the associated patient stay-level data. They include all HIS-based measures, and providers have access to the quality measure data, and this is important, prior to the data correction deadline for public reporting. That's not for every quarter of data that's included on your report, but I'll talk more about that as we move through the slides. These reports provide hospice agencies an opportunity to ensure the accuracy of your data. They allow providers to track quarterly data in a cumulative fashion. They include data from the most current quarter that is open for data correction, and they include data from previous 3 quarters closed for data correction. And I'll caveat that. I'll come back to that also. The previous 3 quarters are not always closed for data collection. One of them may remain, or 2 of these may remain open at the same time, but I'll explain as we move through the slides here. But it's important to note that this report will sort of guide you as to what data can be corrected still prior to the deadline and what data for which the data correction deadline has already passed. This is an overview slide looking at the sort of the differences between three different report types: the CASPER Quality Measure Reports, the Review and Correct Reports, and the HIS Provider Preview Reports. So I'm just going to go per report through this list and talk a little bit about each one. The CASPER Quality Measure Reports, do they always include a full year of data? For the CASPER QM reports, the answer is no. However, and the answer is no, because we have the asterisk here because while they don't always contain a full year of data, they could potentially contain a full year of data if that's what's been requested by the provider that's requesting the report. So if those are parameters that you're selecting, you can see a full 4 quarters of data on this report. The QM reports do include patient stay level data. They do include hospice facility level data. They are not affected by data correction deadlines. And so these reports, the reason why we don't allow data correction deadlines to affect the data within these reports is we want these to be as true a picture of as possible, so that they're available for internal quality improvement at your hospice. Some of the other reports do observe those data submission deadlines, and we have to do that for practical purposes and so that we can do a whole host of processing prior to public reporting. However, with these particular reports, we've decided not to impose those data correction deadlines so that we can really allow you to see as you move along your true data scores. And the CASPER QM reports, can underlying data be changed? Yes, it can. And these reports are run on demand by the user. Review and correct reports, in contrast, they do always include a full year of data when you run the report. Do they include patient stay level data? Yes. Yes, they include hospice level data. Yes, they are affected by data correction deadlines. And so once a data correction deadline passes, you will not be able to correct that data any longer in this report. So any corrections you make beyond that data collection deadline, you will not be able to see the effect of those corrections on your measure scores as far as this report is concerned. The underlying data, can it be changed with these reports? We have a double asterisk here, and the reason is that the answer is sometimes yes and sometimes no. So if a particular quarter, if the data correction deadline for a particular quarter remains open, of course you can correct the underlying data that has to do with that quarter. But if a specific calendar year quarter and the data correction deadline remains closed or is closed for that quarter, you will not be able to correct the underlying data. And this report, the Review and Correct report, is run on demand as well. Lastly, the Provider Preview Reports. This is the report that you receive approximately 60 days before the Hospice Compare refresh happens. It allows you to see what data CMS is going to publicly post related to your hospice. They will always include a full year of data. These are hospice facility level data reports only. They do not include patient stay level data. They are affected by data correction deadlines, so any corrections that are made prior to a data submission and correction deadline will be reflected within these reports. Any modifications that are made after a data submission or correction deadline will not be reflected within these reports. The underlying data cannot be changed within these reports, and these reports are not run on demand. That is, they are automated reports. that CMS runs on your behalf, and they show up in your hospice folders under the CASPER system. Okay, moving along, the review and correct reports data. It shows providers which records, as I said, are still open for data corrections prior to public reporting on Hospice Compare. They show which records are closed for data correction or are frozen and can no longer be corrected for the purposes of public reporting. And each quarter of data is available on this report 1 day following the end of the applicable calendar year quarter. They're available on demand based on a user-selected end date. And so, for example, quarter 1 of a given calendar year is always January 1st to March 31st. And so that particular quarter of data will be available the day after that quarter ends. So the first day that you could see quarter 1's data on any given year would be April 1st. It will show up on that report. And this available on demand based on a user-selected end date. I'll talk more about that as we move forward. There's some slides that reference that. Like this one. Just giving an example again regarding when a particular quarter is available on these reports. So the first day you could review, for example, quarter 4 of 2019, that data would be January 1st of 2020 because that's the first day after the quarter 4 of 2019 ends. And once you select quarter 4, so as we said, these are available and run based on a user-selected end date. So if the end date you selected was quarter 4 of 2019, the report would then include quarter 1 through quarter 4 data for 2019. So let me explain a little bit. If you look over at the teal box on the left-hand side of the slide, it shows quarter 4, quarter 3, quarter 2, and quarter 1. So if you selected quarter 4 of 2019 as your user end date, the report would populate with that quarter and the 3 previous quarters of data. So it would be quarter 4, quarter 3 2019, quarter 2 2019, and quarter 1 2019. When you see these quarters on the report, you'll be able to understand if they're open or closed. The little symbols on the left-hand side of each quarter in the teal box, the little tablet with pencil means the quarter's open, and the little lock means it's closed. So quarter 4, for example, would be open because the data submission and correction deadline for quarter 4 data is May 15th. So quarter 4 of 2019 would have a data correction deadline of May 15th of 2020. So that quarter remains open. Quarter 3 of 2019 would have a data correction deadline of February 15th of 2020. So again, that quarter remains open and would show as open on the report. Quarter 2 of 2019, however, has a data correction deadline of November 15th. So at the point at which you ran this report, that would have passed and data would no longer be modifiable for that quarter. And then the same goes for quarter 1 of 2019. All right, we're going to test your knowledge with a question here. The review and correct report contains hospice-level quality measure data and the associated patient-level data for all HIS-based measures. Is that true or false? I'll give everybody a few minutes to respond here. All right, let's take a look. So again, the review and correct report contains hospice-level quality measure data and the associated patient-level data for all HIS-based measures. And that is true. So it looks like everybody got, most people got the right answer there. So that's fantastic. Second question here. Which of the following statements are true regarding subsequent review and correct reports? A, cumulative data for the review and correct reports are displayed for a full 12 months or 4 quarters based on a user-selected end date. B, when a new reporting year begins, the new quarter of data is added, and the oldest quarter of data is subsequently dropped. C, reports are retained for 10 years. Or D, none of the above. So again, we'll give you a minute or two here to plug in your answers. Looks like we have quite a few responses here, and I will reveal the answer, which is A. Cumulative data for the review and correct reports are displayed for a full 12 months or 4 quarters, and they're based on the user-selected end date. All right, now I'm going to begin to sort of dissect the report a little bit. We're going to show you some snapshots of various areas of the review and correct report and talk about what information is displayed in each of those areas. So what you're seeing here on this slide is a snapshot of the header of the report, and more specifically, it's the left-hand side of the header of the report. And what you'll see here, you see the provider ID, the CMS certification number for the actual hospice name, and then the city and the state in which the hospice resides. Some important considerations when you're looking at this information. We ask that you carefully review the data about your agency, including your agency or provider name, the CMS certification number or CCN, and the date of certification. And when I say that, because incorrect agency information is really a major source of public reporting help desk questions concerning these reports. So it's extremely important, I can't emphasize this enough, to make certain that your Medicare certification date for your agency is correct within the ASPEN system. That is a system that is maintained by CMS, or not CMS, but it's maintained by the government. CMS does not have the ability to either monitor or the validity of the Medicare certification dates within the ASPEN system, nor the authority to issue a correction within the system. So it's, if your certification date is not correct, it's not as easy as sort of sending us a quick note via the help desk and saying, this is wrong, could you please change it for me? And I'm going to go over how exactly you would change that. In the ASPEN system, I'm sorry, it's run by the state. So in order to correct your facility information, if you in fact discover that something is incorrect, you need to contact your Medicare administrative contractor or your MAC to update your agency information. And here, MAC contact information is available at the link that's listed here. And I just want to explain a little bit. When we ask that you contact your MAC, those are the payment people. And the reason we ask that you do this is because many of these sort of demographic points are information that's contained within your CMS certification. So CMS certifies you as a hospice. You're able to receive Medicare payments, and whether you are profit or nonprofit, where you're located, all of those things are information that we maintain about your agency. And so it's important, it's really important that it gets updated in all of our systems. So if it was just to be updated in the ASPEN system, then the MAC doesn't know. If it's only updated by the MAC, then the ASPEN system doesn't know, and we don't know. So unfortunately, at this point, all of these systems are not directly connected. So, there is a way that we communicate this information and make sure it gets to where it needs to be. But the first step is to contact your MAC. You let them know that you need to change, the piece of information that's wrong, whether it's a phone number, whether it is your profit, whether you're a profit or nonprofit, etc. They will make that change, and they will then send a note to the Aspen coordinator at the regional office, and that person will make the same update within the Aspen system. And directions for doing that are located on our website, on the Hospice Quality Reporting Program website. There's a little more extensive directions for that. But a really important thing to pay attention to. I just wanted to stress that. Excuse me. Moving on, so on the right-hand side of the header, you'll see that there's the requested quarter end date. That is the date, or the quarter end date that was requested by you, the user running the report. The report release date. This displays when the requested report was initially released. So this date is fixed, and the date is updated quarterly each time a new quarter of data is available on this particular report. The report run date is the report that was requested by you, the provider, and the data calculation date displays when the data displayed on the report was last calculated. Again, I just wanted to show sort of how this works. So if we look at these columns of quarters here, to understand how the report would populate if you chose each one of these as your quarter end date. So if you chose quarter 1 of 2019, again, that would populate with that specific quarter and the 3 previous consecutive quarters of data. So you would end up getting quarter 2 of 2018 through quarter 1 of 2019 as the full year of data on that report. If you requested quarter 2 of 2019, you would get that quarter, and you would get the 3 previous consecutive quarters of data. So you would end up having quarter 3 of 2018 through quarter 2 of 2019 on that report. Quarter 3 of 2019, you would end up having quarter 4 of 2018 through quarter 3 of 2019 on the report. And then quarter 4 of 2019, you would end up having the full 2019 on that report, quarter 1 of 2019 through quarter 4 of 2019. Another feature of these reports is that you can select certain filters when you run this report. So, for instance, you can run the report based on a specific quality measure to see which records affected or triggered a specific quality measure, and for only that quality measure. Or you could choose just one specific quarter to see what measure was affected by what data during that quarter. You'll see here patients without a discharge assessment. So you could select yes to see all of those patients that have no discharge assessment. You could select no to not see them, or you could select all to see both those patients with and without a discharge assessment. Admission record data correction period as of report run date. So this tells you whether the quarters were open, closed, or all. So you want to see all the open quarters only, you want to see the closed quarters only, or you want to see all of the quarters. Discharge record data correction period as a report run date. The same thing, whether you want to see open quarters, closed quarters, or all of the quarters for those discharge records. And then lastly, measure status. So if you wanted just to see triggered measures, measures that were triggered, if you wanted to see not triggered only, or measures not implemented based on a patient's admission and or discharge dates, you could choose any of those categories, or I believe a combination of to have a more sort of specific report and look at just the specific things related to your data. So it allows a little bit of customization, if you will. So moving on, so below the heading, you'll start seeing the report will look somewhat like this. You'll first see a little table legend there, followed by the hospice level data or the facility level data. And then below that, you'll see the patient stay level data. So as far as the facility level data is concerned, it includes the quality measure numerator, the denominator, and the score for patients who have been discharged within the selected 4-quarter reporting period. It also includes patients with an admission and a discharge at the end of the selected 4-quarter reporting period. So the reporting quarter, so this is the column that's highlighted in orange on the left-hand side of this slide. It indicates the quarter and the calendar year in which the target date of the discharge record falls. It also indicates the most current quarter, or it's also laid out. The most current quarter would be on the top of the table. Cumulative is on the very bottom of the table. So as you see here, it's listed quarter 4, quarter 3, then quarter 2, then quarter 1. And you'll see this for each quality measure if you're running the report generally. If you're filtering out, you may see it just for one quality measure if that's what you're choosing. And the second part here that says reporting period for cumulative row by quarter end date. Again, this is just showing you if you chose a specific quarter end date, what the target period would end up being. Sort of the same thing I just went through with you on a previous slide there. Moving across the report to the right, you'll see the CMS ID. This indicates the specific CMS ID for a quality measure in the specific reporting quarter. The start date is the start date of the reporting quarter. So if it was quarter 4 of 2019, obviously that would be October 1st. And the end date is the last day of the reporting quarter, which would be for quarter 4 of 2019, it would be December 31st of 2019. Moving over to the next couple columns, you'll see the number of discharged hospice stays that triggered the quality measure. This is actually the numerator of the quality measure that you're looking at here. So for instance, you'll see here, there's a 2 in that box. The next column says number of discharged hospice stays included in the denominator. That is the denominator of the quality measure. So you'll see a 5 there. So there were 5 discharged hospice stays that were included in the denominator for this quality measure on this report. And then finally, you'll see the hospice percent. And that is the hospice observed score for the quality measure, which is the numerator count divided by the denominator count and then multiplied by 100. So, for instance, the numerator of this measure was 2. The denominator was 5, so 2 divided by 5 is 0.4. And then 0.4 times 100, or multiplied by 100, would be 40%, which would be your hospice's score. Moving on to the patient stay level data section, this includes record level data. It really provides your hospice an opportunity to quickly identify specific records, either records requiring further investigation, records that contain possible inaccuracies, or possibly quality of care concerns. The reporting quarter, you'll see in the column all the way to the left that's highlighted in orange. Again, same as for the facility level data. You'll see the quarter and the year, the specific quarter and year there. It indicates the quarter and calendar year in which the target date of this particular discharge record falls. If more than one quarter of data appears on the patient's stay level data table, then the most current quarter of data appears on the top. So they will appear in descending order. So you would see all the records that fell in quarter 4 2019, then you would see all the records that fell in quarter 3 2019, then quarter 2, and then quarter 1. A dash will be displayed if the patient has not yet been discharged. So for instance, if you look at the top row in this example, you'll see that there's a dash for reporting quarter and a dash for discharge date and a dash for discharge record data correction deadline. These columns can't be filled in if we don't know what the discharge date was. And those you will always find as the very first records listed. Those records that contain dashes or missing data will always be the very first records that are listed on the patient's stay level data report. Moving along, when you get to the patient name section, the last name, you'll find the last name and the first name of the patient, and then the patient ID, which is an internal patient identification number. Two columns next to that, you're looking at the admission date and the discharge date. The admission date comes from item A0220 on the HIS version 2.0 assessment, and that's a corresponding patient stay. The discharge date comes from item A0270 on the HIS version 2 for the corresponding patient stay. Next year, we're looking at here the two columns that are highlighted in orange, the admission and the discharge record data correction deadline. So for the admission record for this particular patient, if we're looking at Anna Doe on line 2, it was Q4 of 2019. So the data correction deadline for that is May 15th of 2020. And so the date that this report was run, this would still be open as a data correction, as a quarter that's open to data correction. Looking at the discharge record data correction deadline, we would see the same thing here, that the quarter was still open for data correction. And here's actually, when you look next to the correction deadline, you'll see that it'll say either open or closed there. And the same thing for the discharge record, which is in the next column. So open if the run date is on or before the admission record correction deadline. Closed, you'll see if the run date is after the admission record correction deadline. And then the same thing for the discharge record data correction period as of the report run date. All right, lastly, I want to just discuss the status table legend that you'll see on the report. This explains all of the symbols that you may see within the particular report. A dash means data is not available. A bolded X in a column would mean that the record triggered a specific quality measure. A B would mean that it did not trigger or it was not triggered. E would mean it was excluded from the quality measure denominator. C means that the admission date was extracted from the discharge record because the admission record was actually missing. And D means that the measure was not implemented based on the patient's admission and or discharge dates. So again, I want to just review the data correction deadlines for each of the quarters. And this is not just for 2019. This has to do for any given year, but we're using 2019 to explain. So Q1 of 2019, which runs January 1st through March 31st of 2019, the data collection deadline would be August 15th of 2019. For Q2 of 2019, the data correction deadline is November 15th of 2019. Q3, it is February 15th of 2020, so of the subsequent year. And Q4 of 2019, the data correction deadline would be May 15th of 2020. So a good little table to just keep around. Quick reference. So what does a dash mean in the status column on the reports? A dash denotes the data is not available. A dash can also be used for the following reasons. So if we're looking at the hospice percent, and there was a dash there, it would mean the hospice had no qualifying patient stays in the denominator. If we're looking at the discharge date, and you see a dash in that column, it could mean the patient has not been discharged or the discharge record is missing. It could also mean the patient is missing an admission record. The admission record data correction deadline If you see a dash in that column, it would mean the patient is missing an admission record. Admission record data correction period as of report run date. If you saw a dash in that column, it would mean the patient is missing an admission record. If you see a dash in the discharge record data correction deadline column, it would mean the patient has not been discharged or the record is missing. And then lastly, if you saw a dash within the discharge record data correction period as of report run date column, it would again mean that the patient has not been discharged or the discharge record is missing. So this is just a quick reference. When you see a dash, you could easily keep this around, refer to this table. It helps you just quickly identify what the problem could be, why you're seeing a dash there. Again, going over the legend, X means triggered, means the patient's stay was included in the numerator and the denominator of the quality measure. The X, as I said earlier, is displayed in bold font. V means that it's not triggered. What that means is the patient's stay was included in the denominator of the quality measure, but was not included in the numerator. E means excluded from the quality measure denominator, so the patient's stay was excluded from the denominator. Moving on, or continuing, C means the admission date extracted from the discharge was extracted from the discharge record because the admission record was missing. And then finally, D, the measure was not implemented based on the patient's admission and or discharge dates. And so what does that really mean? So what it means, and I'll just give an example here. If there's an admission anchored measure, so a measure that's based on the admission assessment, was first implemented by CMS in quarter 2 of 2019, yet the provider was reviewing their report for quarter 1 of 2019 through quarter 4 of 2019, you would see D displayed for all patient stays with admission dates that fell before quarter 2 of 2019, which was the measure implementation date. Analyzing these reports, access your review and correct reports and investigate measure results, identify opportunities for data correction and or initiating or updating quality improvement strategies. If determined to be necessary, submit, modify, or inactivate HIS records in CASPER. And then access, review, and correct reports the following week to verify updates or corrections. So as you review and correct reports, we update them once a week. And so corrections that you make Tuesday through Friday, Tuesday through Saturday on this week, you're not going to see those corrections reflected until the report is refreshed the following week. So examine the hospice level data for each HIS-based QM measure in the Hospice Quality Reporting Program for the open reporting quarter. Pay attention to the numerator, the denominator, and the score for patients who have been discharged. Examine the patient-level data. This displays a list of hospice patients for whom HIS data were submitted and identifies if a patient was included in the numerator for each quality measure. Identify records for possible data inaccuracies or quality of care concerns. All right, I'm going to go over another knowledge check here. So when a given quarter's data becomes available, the review and correct report provides quality measure results that are updated on a blank basis until the submission deadline. Again, when a given quarter's data becomes available, the review and correct report provides quality measure results that are updated on a blank basis up until the data submission deadline. Just give a few more seconds for folks to respond. All right, looks like we got quite a few responses. And the answer is weekly. So we update these reports on a weekly basis, meaning that we capture all of the modifications, all of the additional submissions that were made during the previous week, and incorporate them into the newly calculated measure scores. All right, at this point I am going to pass it back off to Brenda. Thank you so much.
Okay, thank you, Charles. So let's look at a few case examples to help you better understand how to use this new report. So let's say you're the Quality Improvement Director for a tropical hospice agency, and your role involves routinely accessing, analyzing, and using the CASPER reports to support the work of your agency's quality program. So you now have access to this new report, the Review and Correct report, and this report will allow you to validate the accuracy and correct errors as necessary. And it also provides an opportunity to identify areas for quality improvement. So during a routine analysis, you run the Review and Correct report on Friday, April 5th in 2019, and you notice that a patient discharged at the end of the quarter 1 on Sunday, March 31st, wasn't included in the report. So your agency submitted the discharge record on a Wednesday, April 3rd, and on Thursday you confirmed that the submitted record was accepted. So here's a question for you. So why was the discharged patient not included in the Review and Correct report on April 5th? Was there a problem with the system? Maybe you don't have a clue. You need to wait a month for the patient data to show up. The report data refreshes weekly, so you need to wait till Monday, April 8th to pull that report? Or is it none of the above? Okay, it looks like most of you, all of you, are answering C. Looks like we've got one person that answered A. So the answer is C. The report data refreshes weekly, so you would need to wait until that Monday, April 8th, to be able to pull that report to see any changes or corrections that you have made. So let's take another situation. So on Tuesday, July 2nd, 2019, you access the Review and Correct report. Now a reminder, quarter 2 data is added on July 1st of 2019. So upon examination of the report, you notice that the quarter 2 hospice level measure performance rates are lower than what you expected. So what steps should you take to further understand the data in the report? So answer A would be to examine the patient's stay level data to understand which patients did not trigger the measures and investigate the accuracy of the HIS data submissions using other reports in CASPER. Or B, you'd need to wait until July 31st for the data to show up. C would be to call and report a problem with the system. Or D would be none of the above. Okay, and it looks like most of you have answered A, which is the correct answer. Examine the patient's stay level data to understand which patients did not trigger the measure, and then you can investigate the accuracy using some of your other reports that we talked about earlier in CASPER. So here's another situation. So on July 3rd, after investigating the data, you discover that there are errors in the HIS data submissions. So on July 5th, which is a Friday, you submit the modified HIS assessments to the Quality Improvement and Evaluation System Assessment, Submission, and Processing, which is the KEYS ASAP system. So when should you check the Review and Correct report to confirm that the measure performance was updated? Would it be on that Friday? Would it be the Monday, July 8th? Would it be the end of the month? Or are B and C correct? A few minutes to think about that one. Like some people are changing their answers. So about 2/3 of you answered B, and 1/3 of you answered D. So both B and C are actually correct. So certainly you can wait till the Monday, but at the end of the month you would have the full report as well. So actually a little bit of a trick question, but they're both correct. Okay, we have one more situation. So on Thursday, November 14th, 2019, you access the Review and Correct report. You get busy, and you can't look at the report until late on Friday, November 15th. So you discover some errors and decide to submit modified data on Monday, November 18th, but you're unsuccessful. So here's the question. Why was there a problem with submitting corrected data? There was a problem with the keys system, and you need to contact for technical support. Or B, you need to wait a few days for the system to refresh. Is it C, you waited too long and missed the deadline for Q2 data correction of November 15th? Or is it none of the above? It looks like about 75% of you have answered C. You waited too long and you missed the deadline for the Q2 data correction of November 15th. So remember Charles showed this same slide earlier. So these are the deadlines. So you can see the quarter and then when the deadline is for correction. So if you go past that 11:15 and if you wait to the last minute and you can't submit, then you could actually miss being able to correct that. So this is a really good tool. You could even print out this slide and keep it handy for yourself. Okay, so let's summarize. The Review and Correct report contains hospice level QM data. This report is user-generated. Provides an opportunity for hospice agencies to review the data and make modifications if needed before the data is made public, as long as the run date is on or before the correction deadline. It provides feedback to hospice agencies to help facilitate quality improvement efforts, and it covers 12 months, 4 quarters of data. And the data refreshes weekly on Mondays. So let's just review some HQRP resources that you can have handy. So here's some resources for the CASPER report explanations. They can be accessed here on that first resource. And then there are specifics regarding the HIS quality measures. It can be found on the HQRP website. You can also use Getting Started with the HQRP, and this can be accessed. It's a PDF that's also on the HQRP website. So for questions regarding error messages or other technical questions, for user IDs or technical training, you would email the help@qtso.com. You can also call them. There's a phone number here as well. The HIS manual can be accessed using this link below. And again, this is on the Quality Reporting website under HIS item set. You can download at the bottom of the page, you can download the manual. And for questions about the HIS and general questions about HQRP, you can email the Hospice Quality Reporting Desk. So I think Sharon's going to lead us in some questions that we have.
Okay, so we have a few minutes left for some Q&A. As the presenters were going through the presentation, some questions came in, so let's begin reviewing and having them respond to some of the questions. Let's take a look at the first one. If there is a dash listed in the report, is there an issue? Charles, can you provide a response, please?
Of course, thank you. Yeah, when you see a dash in your report, we ask that you review the table legend on the report. The dash indicates that the data are either not available or they're not applicable. However, providers should always confirm that all of the required data have been submitted if applicable.
Charles? I cannot access our agency's review and correct report. Where do I go for help? Brenda?
Yep, sure, I can answer that one. If you have any technical issues requesting or accessing the reports, you can contact the Keys Technical Support Office Help Desk by email at help@qso.com or by phone. It's an 800 number, 339-9313.
Okay. This next question is for Charles. Is there a recurring day of the week that reports are refreshed?
Yep. So the weekly quality measure data calculations for the review and correct reports are performed early in the morning every Monday.
So, the next question is, I have a question in regards to the HIS submissions for Medicaid patients. I am not sure if it is mandatory to submit the HIS in our state. How can I find out? Brenda?
Sure. So you can find this answer in the HIS manual. And an HIS is required for all patient admissions to a Medicare-certified hospice regardless of the payer source, the length of stay, the patient's age, or the location where the patient receives hospice services. And you can find this answer in the manual, which is located on the CMS website, and there is a link to that website and that page on slide 93.
Thank you, Brenda. How often are review and correct reports refreshed? How soon are corrections and edits reflected on the report? Charles, can you take that question?
Of course. Okay, so data for the review and correct reports are updated, are refreshed in a few different ways. So for weekly measure calculations, they're performed in the early morning hours every Monday, as I covered earlier. However, there are also quarterly measure calculations that are performed. So in order to allow sort of a quarter to be displayed on the CASPER review and correct report, as soon as that quarter is completed, the review and correct report quality measures are calculated and updated in the early morning hours of the first business day of the following quarter. So this is essentially an extra weekly run that occurs on the first business day of a new quarter. Then there are also end-of-quarter calculations that are performed. And so to close a quarter, the review and correct quality measures are calculated and updated 4.5 months after that quarter is completed. If you remember, there's 4.5 months after every quarter during which you can modify or correct your data. So we then perform another data calculation 4.5 months after the quarter is completed. On the 16th day of February, May, August, and November, the quarter will be processed and marked as closed. So in the event of a weekend or holiday, those updates just simply occur on the next business day. Newer corrected records with target dates during the quarterly period that were submitted after the data correction deadline, I just want to point out, will not be included in the weekly quality measure calculations for the review and correct report.
Thank you, Charles. I'm going to let you catch your breath so you can respond to this question. The question says, you said that review and correct reports would be available on a quarterly basis, but they would be updated weekly. Can you please clarify? If the reports are updated weekly, how are they only available quarterly? Charles?
So the review and correct reports are available on a quarterly basis for up to the past full 4 quarters as the data are available. So the reports include information regarding whether the data correction period is open or closed, which means whether assessments can be corrected or not. So the reports are refreshed or updated weekly to reflect any changes made to the HIS assessment data. So if you see the difference there, the reports, beyond showing you if a data correction period is open or closed. They also are refreshed on a weekly basis to capture any modifications that are made by the hospice.
Thank you, Charles. The next question says, now that there are review and correct reports, do I still need to review the other CASPER quality reports? How do the reports all differ? And what's the purpose and value in each report? Brenda, can you take this one?
Sure. So yes, it's recommended certainly that hospice agencies take advantage of all of the reports that are available in CASPER. There are numerous provider reports serving a variety of purposes, which can be used in conjunction with the review and correct reports and help you identify errors or missing data. The quality measure reports include national average scores that allow you to benchmark and for comparison. Again, and they also allow you to get into more detail about what happened based on what you're seeing in your review and correct and your provider preview reports.
Thank you. How do I know if I have incorrect data? Charles?
Okay, so you should have a basic idea of the number of patients your agency discharged for any given quarter. So the hospice level data section of the report includes the QM numerator, the denominator, and the score for patients who have been discharged within the selected 4-quarter reporting period. The patient state level data section provides information related to which patient triggered a specific quality measure and an opportunity to quickly identify patient records requiring further investigation or possible data inaccuracies.
Okay, thank you. Brenda, can you respond to this question? Is there a penalty for submitting a correction more than 30 days after the initial assessment date?
Sure. Well, all HIS records must be submitted and accepted electronically into that KEYS ASAP system within 30 days of the event date. So that's the admission or the discharge. Timely submission and acceptance of the HIS records is a requirement to comply with the HIS reporting, and it can impact your hospice's compliance determination, which relates to your annual payment update. Now, modifications and inactivation requests can continue to be submitted for up to 36 months from the record target date, and this will change as of the fall to 24 months. However, HIS data that is modified after the 4.5-month data correction deadline will not be considered for purposes of public reporting, and thus it's not going to appear in the Hospice Compare. So for more information about the data submission deadline, it can be found on the Hospice Quality Reporting webpage, and that's the Medicare Hospice Quality Reporting webpage, and go down to the bottom to the download section. Information about modifications and inactivation requests can be found on the CMS Hospice HQRP website on the Hospice Item Set webpage, and that's also located under the downloads section. And that particular link is also on the slides at the end for resources.
Okay. I think we have time for a few more questions. How often do you recommend that an agency pull and review its reports? Charles?
Okay, so it's important providers use the review and correct reports while the data correction period is still open, so that they have as much time as possible to correct the information if necessary. Therefore, obtaining and using the reports shortly after they become available is really advisable. By checking the reports as early as possible, you can certainly help ensure that you have ample time to make any corrections prior to the applicable quarterly data correction deadline. And in addition, your own agency may have policies and procedures that inform the frequency of such review.
If someone wants to know, are state and national benchmarks available for the review and correct reports? Brenda, can you take this one?
Sure. No, not at this time. The review and correct report only contains agency-specific data at this point.
On what dates do the review and correct reports come out? Charles?
So the review and correct report is a user on-demand report, which is accessed via CASPER. So when a reporting quarter ends, an updated review and correct report for that quarter is made available on the next business day. So there are specific days on which a specific quarter of data is available, but you can run these reports at any time.
Thank you, Charles. Brenda, I have this question for you. If we have a large volume of submissions, how do you suggest we review our sample for best outcomes?
Okay.
Brenda?
Yep. Strategies and best practices for reviewing agency outcome data should be guided by your agency's policies and procedures. So there are numerous provider reports available for agencies to stay current with their data and monitor their HIS submissions for accuracy and acceptance. And these QM reports, can provide an opportunity for benchmarking as well.
Thank you, Brenda. I am new to QA in my agency. I am not clear about the phrase, patients who did not trigger the measure. What exactly does that mean? Charles, can you respond?
Sure. So the phrase is used on the patient stay level report for each quality measure. And the actual phrase, patients who did not trigger the measure, means that these patients did not meet the inclusion criteria for the numerator of a specific quality measure. This could be an indication of missing or inaccurate patient data for the specific quality measure, requiring further investigation.
How long is the correction period? Brenda, can you take this one?
Sure. The correction period. The correction period for the review and correct report falls approximately 4.5 months after the end of each calendar year quarter. So the deadlines for each calendar year quarter are as follows. It's the quarter 1, August 15th, quarter 2, November 15th, quarter 3 would be February 15th, and quarter 4 would be May 15th. And again, there was two slides there that gave these dates, and it would be good for people to print them out and to keep them handy because they would be good references in the future.
Well, thank you, Brenda. It looks like we've responded to several of the questions that we could answer today. Some questions may require additional research. If you submitted a question and it was not answered, it will be distributed to the appropriate help desk. They will be posted to the HQRP requirements and best practices webpage as soon as responses have been drafted. Before we wrap up today's event, I want to thank Brenda and Charles for the valuable knowledge shared during today's webinar. This concludes the Hospice QRP Review and Correct Report webinar. We also want to let you know that the full version of the slides, including the answers to the polling questions, as well as the recorded version of the webinar, will be posted. We will send an email notifying you when and where those items have been posted. Thank you all for attending today's webinar. Enjoy the rest of your day.